CDC is warning about low vaccination rates for a variety of respiratory diseases and illnesses ahead of the holidays. The number of infections are rising, could go up as families and friends, we're all gathering for the holidays. Joining us to talk about what we can do besides avoiding our family, which is unavoidable for most of us, Dr. Jeff Pothof, UW Health Chief Quality Officer. 'Tis the season to spread joy in respiratory illnesses, Doctor.
It sure is. I mean, it comes as no surprise. We've been talking about this for months now, but unfortunately, respiratory season has decided to land itself right in between our two major holidays, Thanksgiving and Christmas. And we're starting to see that both nationally, but even here locally. Influenza numbers increasing, RSV is on the rise. COVID's been higher for a while already, but staying high. And now we're all going to gather together. What can people do? I think one, and this can be hard, I realize this is hard. If you are sick and you're acutely sick, don't go to Christmas. Don't get everyone else sick. Don't even go to work. But otherwise, we got to practice good hand hygiene, wash your hands, soap and water, alcohol sanitizers are great. We teach our kids this, but you want to cough into your elbow or into a tissue, not into the open air. And we've been harping on this too, but you can significantly reduce your likelihood of severe disease, i.e. coming to see me in the hospital. If you get vaccinated, get that immunity built up before you come in contact with any of these respiratory diseases.
Vaccination rates are pretty terrible, less than 20% for COVID, less than 50% for the flu shot. That's hovering about 40%. This warning from the CDC went straight out to doctors. Why are they talking? What do they want doctors to talk to their patients about?
I think it's twofold. One, we want patients to get vaccinated, but two, patients often look to their physicians, their doctors, for recommendations on what they should do. So, as much as everyone else is fatigued with, pandemic and vaccines and respiratory illnesses, doctors might be getting there too. But it's important to remind our patients that it's important to get vaccinated. All the reasons, both personal and then for the community, that's just a good thing to do. Go over those risks and benefits. I think there's some fear about, do vaccines have adverse effects? Should I be worried about that? It's our job as physicians to explain risks, benefits, and why we think someone should get vaccinated.
And there are no dumb questions to your doctor. We know because sometimes we ask you some very dumb questions here on the air. Hey, speaking of vaccines, tell us about the cancer vaccine getting a lot of headlines this week, whose creator says it may be able to eliminate various forms of cancer.
Yeah, this seems almost sci-fi, but it really is exciting, and it's probably not ready for prime time. But when you think about like our kids or our grandkids, vaccines will likely be used to cure cancer. This vaccine, which is early on, it's a phase 1A trial, looks to cure women who have triple-negative breast cancer. The study's focused on those who get recurrence. About 50% of women will get recurrence of triple-negative breast cancer, and it's not a good player. It often is metastatic. It spreads. This vaccine does what sounds so simple but is very hard. The best defense against things going on in your body is your own immune system. So it trains your immune system to attack and kill cancer cells. This could work for breast cancer. It could work for other cancers. It probably really is the future of cancer treatment therapy.
And it's not just an idea. This is actually being tested on humans right now. There are patients who have this vaccine in them.
You're absolutely right. So phase 1A trials, small numbers, but people are getting this vaccine. They are studying it. It's closer than we think. This used to be kind of things that you would just see in the movies. Now it's real life.
As we almost finish out the year here, a lot of hope as we head into 2024. Dr. Jeff Pothof, we want to wish you a Merry Christmas and Happy Holidays. Our final time talking to you in 2023.
See you next year.
We'll see you next year.